Hi, my name is Lauren Sullivan, and I am doing my communicable disease project over Lyme disease. Okay, so this is going to be the slide where I insert my YouTube video link of the video that I am actively recording right now. This is my table of contents slide, so I will be discussing the disease overview, an epidemiological analysis, risk factors, my proposed public health intervention plan, and my references. So first up is the disease overview. So as stated by the CDC, Lyme disease is a debilitating illness that is caused by the spiral-shaped bacteria Borrelia burgdorferi, which is transmitted through the bite of an infected black-legged tick, otherwise known as a deer tick. And after the first bite, the symptoms typically present as a bullseye rash, which is the most common symptom, headache, neck stiffness, joint and muscle pain, facial palsy, which is the paralysis of the facial muscles, and dizziness. So the image that I provided on the left is the most common and recognizable indicator of Lyme disease, and the picture on the left of this slide is what the facial palsy looks like, because that is not a very common symptom. So the gist of how this disease works is once the bacteria enters your bloodstream from the bite of an infected tick, it travels throughout the body, which causes the symptoms that I have previously mentioned. And the symptoms form because your immune system immediately recognizes the foreign bacteria, and it causes your body to become inflamed. And because of this defense mechanism, your white blood cells have to fight off the infection, which causes the symptoms such as like the rash or pain. So next up, I will be going into the epidemiological analysis. So, looking at this data globally, 14% of people worldwide have Lyme disease, with Central Europe and East Asia having the highest prevalence outside of North America. And in the US specifically, 476,000 people are diagnosed each year. And upon doing other research, finding statistics of other countries was difficult because mainly North America and Europe have the highest amount of cases. So looking at the data from the years 1992 to 2016, the rates of Lyme disease were higher in ages 5 to 10, as well as ages 45 to 55, which I will touch on this a lot throughout this presentation, but this is due to these two populations of individuals being outside a lot. So on the map of the United States in 2023, on the left, cases were most prevalent in the Northwest regions, primarily in like Minnesota, Wisconsin, Michigan, and all the New England states. And on the right-hand side of a worldwide map, globally, cases were mostly prevalent in North America, Europe, and Asia. So more specifically in the United States, the map here on the right-hand side highlights states such as Massachusetts, New Hampshire, Vermont, Maine, Connecticut, Rhode Island, New York, Pennsylvania, New Jersey, Virginia, North Carolina, California. And while the West Coast does not have high prevalence of Lyme disease, there is a species of tick in this area that does have the bacteria, So that's why it is listed on this map. But as you can see here in the green states, that is what the CDC documents, and the states in blue is what my Lyme data documents. So, in a survey done examining different demographics from the years 2008 to 2015, gender, age, and race were examined. So, rates were higher among males than females. And this is due to the fact that outdoor activities are favored by the male population more than the women population. And for age, similarly to what I mentioned earlier, the age groups were 5 to 9 and 50 to 55. And this is because these groups partake in activities such as playing outside, yard maintenance, hiking, hunting, and this is all done in tall grass or wooded areas. So nearly 90% of the cases that were seen were in white individuals, which this could be due to the fact that the areas that Lyme disease is found in is not in a very diverse area. An income level is not directly mentioned in this study, but just from doing other research, individuals in upper and lower classes were affected just because ticks are found in rural areas or your backyard, and this could just affect any income level. So as of 2019, the death rate associated with Lyme disease was very low. So while this disease is not necessarily fatal, it does cause long-lasting health problems due to there being no cure as of now. And economically, Lyme disease has caused a massive burden on the United States healthcare system because between the costly medications and lab tests and appointments and diagnosing and treating, it is very costly, which is seen here by $345 to $968 million a year. So moving on, I will be discussing the risk factors. So the three main risks that are associated with contracting Lyme disease are behavior, genetics, and biology. So in terms of behavior, owning pets such as dogs that frequent the outdoors often, and spending time outdoors in grassy, woody areas, doing things such as playing outside or hunting or gardening are all behavioral risks. In terms of genetics, Lyme disease is not inherited, but there has been some research done pertaining to how our body reacts to this disease. So in a study done with Finnish and Estonian individuals, the protein SCGB1D2 that is found in our sweat glands has been shown to slow the growth of Lyme disease. And this is the body's natural defense mechanism. And scientists and researchers are using this information to help with further research for developing a cure. And lastly, in terms of biology, people with an already weakened immune system are at a higher risk of becoming sick from this disease, as well as the younger and older age groups. So, another important risk factor is the environment. So ticks thrive in woody, grassy areas where they can hide before attaching to pets or deer or even humans. and they need warm temperatures and high humidity to thrive and survive. So peak Lyme disease and tick season is in the spring and summer months. Deer are also the biggest host for ticks because they are able to freely feed all of their blood, and these are found in low populated areas or backyards. So there are some risks that can be changed and some that cannot. So on the left-hand side, I have risks that can be changed. So the first one is where you spend time outdoors. Avoiding the woods and tall grass is a good way to reduce your exposure to ticks. Wearing long sleeves, tall socks, pants, all of those types of outfits are a great way to help ticks not penetrate into the skin. Wearing bug spray or insect repellent can also help lower the chances of becoming bit. And if a tick is spotted on your body, removing it quickly and receiving treatment can help with the severity of the disease. So on the right-hand side, I have risks that cannot be changed. So if you already have a weakened immune system, your body is naturally going to be more vulnerable to contracting the disease. And the next two, keeping deer out of your yard and where you live, are not easy fixes because you cannot just get the deer out of your yard and you can't just up and move. So those are some risks that cannot be changed. Lastly, I will be discussing my intervention plan that I have proposed. So my proposed solution is a vaccination program that targets young children and older adults, since these are the groups that are at higher risk for contracting Lyme disease due to how much time they spend outdoors. So Pfizer has partnered with Valneva to create the vaccine VLA15, which there is a clinical trial ongoing called Valor, which stands for Vaccine Against Lyme for Outdoor Recreationists. And the vaccine works by targeting the outer surface of the protein of the bacteria that is found in ticks. And while this vaccine is not FDA approved yet, they are in phase 3 of the clinical trial as of 2024. So the two groups that I am primarily targeting are children and older adults. So children enjoy playing outdoors by riding bikes or just playing in the woods or grass. So with this age group, they are not likely to remember to wear bug spray or protective clothing. And so administering a vaccine to this age group would help protect them since they're not capable of protecting themselves. As for the older individuals, they also frequent the outdoors with doing a lot of outdoor activities such as, hiking, lawn maintenance, hunting, whatever it be. And while they are more likely to wear, protective clothing or insect repellent, their immune systems are beginning to decline, so they are a little bit more vulnerable to getting infected, which is when the vaccine comes into play. So I would implement this by ensuring that children are vaccinated before the summer starts, before they get out of school, because the peak season is the spring and summer, so ensuring that pediatricians' offices and school nurses are administering vaccines early on will ensure that children are protected. As for the older adults, getting vaccinated at their usual doctor's office or a community clinic would be the best approach. Also, setting up mobile vaccination spots in parks or trails could better target this population. Educating both of these age groups in an age-appropriate way is very important, so easy to read words or graphics could be handed out before and after the vaccine, just discussing what Lyme disease is and what the vaccine entails. So, there are quite a few obstacles if this vaccine were to be implemented. First, parents could be hesitant to vaccinate their child because it's seen as too new or unnecessary, which, while this could be true, educating and reassuring the parent about what the vaccine does and why it is so important would be beneficial. And depending on how much the vaccine costs, since it is so new, and since insurance might not cover it, it could be quite costly. Also, older adults would think it's useless because, they are on the older end and they might think it's not something for them, but any sort of protection against Lyme disease is crucial. And then the usual side effects of this vaccine, obviously I'm not sure what the side effects would be, but that is a good concern, so just educating the patient on how to handle the side effects and just education in general about the risks could be helpful. And then misinformation is pretty common with new vaccines, so addressing the public with the facts could help people get past this. And then short-term goals, looking at the amount of people who actually received the vaccine and how many brochures were distributed, could reflect the success of the program. And in the long run, if the actual numbers of Lyme disease were lowered, and ensuring that funding is remaining constant so that people can continuously get the vaccine is also another way to measure success. And this is my works cited page. So to conclude, Lyme disease is a pretty debilitating disease, and it has a severe impact on your health and quality of life. But understanding the two populations that are most at risk and implementing effective intervention programs would help reduce the burden. So, thank you.